Today I'm going to do a demonstration of how to use Dermal Revolution deep filler to augment the cheeks, and our patient today is Jean. Thanks Jean for your help. So one of the main things I like about the Dermal Revolution filler is that we have every gradation on the syringe is marked, and also we have a nice strong grip there for the syringe. So as you can see, I've marked Jean's cheeks off more or less symmetrically with a makeup pencil, and those are the little boxes that I'm going to give my injection. So I'm going to aim to give 3 injections into each cheek, and I recommend that you use 1 ml per cheek, although some patients, especially if it's their first time, will prefer to go for half a ml each cheek. For Jean today we're going to go for 1 ml each cheek. So I've marked off my little box. You can swing around towards me. This is my little rectangle. I've felt that this is overlying the bony prominence, so it's really the zygomatic arch, and you'll notice that although the zygomatic arch comes back further, I've decided to inject at the front area. This is because this gives the best definition, augmenting this part of the cheek. If we go any further forward, of course, there's risk of going near the infraoral foramen. So we're well away from that. Going to be right around here, right onto bone. The first injection is going to be right at the front here, and we're going to go for 0.4, so it's perpendicular to the skin, straight down in, and you should hit bone, and your aim is to give this injection right on top of the bone. I'm going to pull back my plunger, make sure I'm not getting any blood back into the syringe, and then I'm going to slowly inject. And the safest thing to do is to do this injection slowly, just like with any filler. If you're in a rush or you try to do things fast, it's usually with people who feel more experienced. If you try to do it fast, that's when you run into problems. So do it slowly, no matter how confident you are. And as you're injecting filler in, the needle will start to be pushed away, out. So you need to make sure your needle stays in place while you're injecting. Depending on how much filler you're using, you could be using quite a large volume here. So 0.4 mils we're using here. It gives quite a stretch, so it can be quite stingy. That's 0.4 in there. Okay, so you can already, even from standing at this angle, I can see there's a nice augmentation there. So the first one always makes the biggest impact. I'm just going to go 1 centimeter back from that, and I'm going to do the same again. I'm just going to check again. I can definitely feel I'm going right down to bone, about 1 centimeter behind that. Another injection perpendicular, and I've given 4 for that first one, 0.4 mil. This one's going to be 0.3 mils. So again, because I put my needle in a different place, pull back from the plunger, not in the vessel, so I'm happy to proceed with that and give 0.3 into this injection site. That's 0.1. You can see how slow I'm doing this. That's 0.1. I'm being slow and careful. It's 0.2. 0.3. That's the second injection in. Okay, and for the third injection, we're going to go 1 centimeter behind that again. So this is the third and final injection. And again, I felt that it's on the zygomatic arch again. I have put my needle into the bone, pulling back on the plunger to make sure I'm not in a vessel, and then I'm happy to go ahead and give another 0.3 mils. 1. Again, nice and slow, no matter how confident you are. Make sure you do this nice and slowly. That's 0.3. I've got a little bit left in my syringe because I had a little bit extra in the syringe to start with, which is fine. So the key here is if you would swing around and get Jean from the front there, please, Ruth. You can see, yeah, it looks nice anyway. The key with this is that I've given 3 boluses. 1, 2, 3. So 3 fairly large boluses of filler. You'll notice that I haven't jumped in to massage the cheeks. I leave that until the very end, and I do a very minimal amount of massaging, which I'll talk you through whenever we get to that stage. So the technique here, obviously the same as the other side. We're going to feel for the bone, feel for the zygomatic arch. We're focusing on the front part of the zygomatic arch, even if it comes right the way around to here. We're focusing on the front half of it. And whenever I feel the bone, I stop, pull back on my plunger, make sure I'm not getting any flashback of blood. Then I slowly inject, and I'm just going to twist my syringe around, which doesn't hurt the patient turning the syringe around, so feel free to do that so that you can see your gauge. And then slowly inject. The slower you inject, the less painful it will be, but also gives you much more control. You're not going to cause any major damage if you work slowly, because if you're doing anything that's going to cause harm, the patient will experience an increased level of pain, so they will be able to alert you to the fact that you're about to do something wrong. And just be aware that your filler that you're injecting is going to tend to push the tip of your needle away, but you need to make sure that you stay right down in the periosteum. So I'm just going 1 centimeter behind that, still on the zygomatic arch. Again, pulling back on my plunger to make sure I'm not in a blood vessel, because I have put my needle tip in a different location than the previous injection. I'm happy to proceed again slowly. This time I'm giving 0.3. So I like to give 0.4 at the front, 0.3 behind, and 0.3 behind that, and that's where you get your full 1 mil from. Okay, here we go. This is the final injection of the 6 injections for the cheek. Again, perpendicular to the skin, right down to the zygomatic arch, right down to the bone. You can feel that. You want to stay on the periosteum, pull back on your plunger again, make sure you're not in a blood vessel, and slowly inject 0.3 mils. So we've done 0.4 at the front, 0.3 behind that, and another 0.3 behind that. You could, of course, give these injections in a slightly different way. You could give 4 injections with slightly smaller volume in each. You could give the same number of injections with a higher volume in each. If somebody knew from the outset they wanted bigger cheeks, that would be fine to do that. So, as you can see, I've wiped off the makeup marks that I had drawn on Jean's face. The filler is in. We have given 1 mil to each cheek. I haven't done any moulding yet. No massage, no moulding. I like to do that at the very end. There's 2 reasons for that. One of the reasons is that the filler tends to merge together. So I've given 3 boluses each side. Those 3 boluses, they're a centimetre apart from each other. They will merge together slightly. Whenever I started doing cheeks, I used to spend a bit of time massaging and moulding these 3 boluses together into one smooth implant, that sort of shape. I used to do the same both sides, and I found whilst that worked well, what happened during that process is the lift that I had achieved was flattened down, and that makes sense. As you'll see in this diagram, you'll see the difference in lift for the volume of filler that you've used. So what I tend to do now is I want to make sure I don't leave any lumps. Like with every filler, you don't want to get any lumps. But here the cheeks seem to be able to tolerate you giving 3 boluses with a gap in between. So right now I can put my fingertip in and I can feel the gaps between the boluses. But the tissue itself remains taut in between because of the size of the gap. It isn't too big a gap between those boluses. So actually leaving those 3 boluses the way they are gives a better lift because the volume has been used more effectively. So I'm not going to do too much in the way of moulding. I'm going to look at the other side here as well, and similarly I haven't massaged this, but there are 3 boluses there and I can get my fingertip in between them, but I'm not going to try to massage those together because to do that it would have to reduce the size of the cheek by moulding those boluses together. What I want to make sure is, and I need to look at the patient straight ahead, I just want to make sure that I have given these injections and they still look symmetrical, because obviously this is like any other dermal filler. You can mould this, you can squidge it up a bit, down a bit, forwards, backwards a little bit. It's better to get it in the right place, but it's nice that you can check it. It's very forgiving. So I'm just feeling things are nice and symmetrical and even, and it feels good. And it comes around to the same point as well. It comes around right to the lateral canthus, which is just exactly where the point of Jean's cheeks are. So I think that's us pretty much done. Don't see any lumps, but I can feel them. I can feel the boluses, which is what I want. If a patient does look at themselves in the mirror and does think, oh my goodness, my cheeks are too pronounced, well then at this stage, then you can just go ahead and put a bit of pressure on and mould the cheeks, and by moulding them you will reduce the size of the cheeks. So it gives you that option. So it's very easy to fix if the patient feels their cheeks are too enlarged.